When Allied forces captured the Afrika Korps in Tunisia during May of 1943, they suddenly found themselves responsible for roughly 275,000 German and Italian military personnel who had become prisoners. Within this enormous group of captured soldiers were German physicians and surgeons who were about to witness something they never could have anticipated based on their understanding of warfare and military conduct. Rather than being treated merely as defeated enemies locked away behind barbed wire, these medical professionals would discover that their American captors viewed them first and foremost as fellow doctors, colleagues in the healing arts who deserved professional respect regardless of which uniform they had worn. This wasn't propaganda or isolated incidents of kindness, but rather a systematic approach documented in military records, inspection reports, and the personal accounts of those who lived through it. The framework for how these German doctors would be treated had actually been established more than a decade earlier through international agreements signed in Geneva during 1929. These conventions created specific rules about how captured medical personnel should be handled during wartime, distinguishing them from regular combatants and affording them certain protections and privileges. The architects of these agreements understood that medical professionals occupied a unique position in warfare, dedicated to preserving life even amid the machinery of death, and deserved recognition of this special status. When the United States signed on to these conventions, they committed themselves to upholding these standards, and unlike many signatories who paid lip service to international law while ignoring it in practice, the Americans took their obligations seriously and implemented them with remarkable thoroughness. The Geneva Agreements specified that prisoners must receive equal treatment, which translated into German captives being paid according to American military wage scales matching their ranks. Officers could not be forced into labor, a provision that recognized their status and prevented their exploitation. For medical personnel specifically, additional protections existed preventing their assignment to non-medical work and preserving certain professional rights and dignities. German medical officers arriving in American custody quickly discovered that their captors didn't just acknowledge these rules on paper, but actively enforced them, often going beyond minimum requirements. Many of these physicians had grown accustomed to the arbitrary nature of military authority under their own command structure, where regulations could be bent or broken at an officer's whim. The American commitment to following established procedures, even when dealing with enemy prisoners, represented a different philosophy of military organization that surprised and impressed them. The journey to American prison camps began aboard Liberty ships making their return voyages across the Atlantic. These vessels had carried war materials and supplies to Europe and would have sailed home empty if not loaded with prisoners. During peak periods, as many as 30,000 German captives arrived monthly at ports along the eastern seaboard, primarily New York and Virginia, where processing facilities had been established to handle this massive influx of humanity. The voyage itself provided the first indication that American treatment of prisoners would differ dramatically from what these men expected. Instead of being packed into cargo holds or livestock cars as prisoners were commonly transported in Europe, they travelled in actual passenger accommodations with assigned bunks and regular meal service. The food served during the Atlantic crossing made a particularly strong impression, substantial portions of meat, vegetables, bread and coffee that exceeded what many German soldiers had received even before their capture. This wasn't humanitarian sentiment overriding military efficiency, but rather a practical application of Geneva Convention requirements combined with American agricultural abundance that allowed adequate feeding of prisoners without sacrificing resources needed elsewhere. By late 1943, German prisoners were being distributed across an extensive network of camps that eventually spanned nearly every state in the continental United States. Texas received a particularly large share of these facilities, partly due to logistical convenience, but also because Geneva Convention provisions required that prisoners be housed in climates similar to where they were captured. Since many German soldiers had been taken in North Africa, the hot, dry Texas climate was deemed appropriate. 3 major installations were authorized in Texas during 1943 alone. Fort Sam Houston in San Antonio initially consisted of little more than canvas tents, with 236 large military tents housing both the German prisoners and their American guards in what amounted to a temporary city. Camp Howze near Gainesville and Camp Hood North at Killeen followed similar patterns, rapidly constructed facilities designed to handle thousands of prisoners while meeting basic standards for shelter, sanitation, and security. The medical facilities at these camps varied considerably, depending on their size, purpose, and available resources, but generally they exceeded what German medical officers anticipated. Most camps maintained infirmaries capable of handling routine medical issues, minor injuries, and common illnesses. Larger installations featured substantial hospital facilities with operating rooms, recovery wards, and specialized treatment areas where German medical personnel could practice their profession under American supervision. The supplies and equipment in these facilities often surpassed what German military hospitals possessed, even before Allied bombing had destroyed much of Germany's medical infrastructure. Surgical instruments, diagnostic equipment, medications, and basic supplies like bandages and sutures were available in quantities that seemed almost wasteful to men accustomed to making do with limited resources. What truly distinguished the American approach, however, wasn't the physical facilities or material abundance, but rather the fundamental attitude toward captured medical professionals. American military physicians didn't view their German counterparts primarily as enemies who happened to have medical training, but rather as fellow doctors who happened to be prisoners. This perspective manifested in countless small interactions and larger policies that collectively created an environment of professional respect. German doctors were addressed by their medical titles rather than simply as prisoners or by rank. They were consulted on medical cases, their professional opinions solicited and seriously considered. When complex cases arose, American physicians didn't hesitate to discuss diagnostic challenges and treatment options with their German colleagues, engaging in the same kind of professional consultation that would occur among peacetime medical staff. Multiple accounts exist of American doctors freely teaching German physicians new procedures while simultaneously learning from German experience with battlefield trauma and surgical techniques developed under combat conditions. The American Medical Corps extended the same standard of care to wounded German prisoners as they provided to Allied casualties, a policy mandated by international law but frequently ignored by belligerent nations. German soldiers with combat injuries received the same surgical procedures, post-operative care, medications, and rehabilitation services that American wounded received. This equality wasn't theoretical but practical and observable, with German patients occupying beds alongside American soldiers in the same wards, attended by the same nurses, receiving medication from the same pharmacies. German medical officers working in these facilities witnessed this equal treatment standard firsthand and participated in delivering it, gaining experience with American medical protocols and ethical standards that would influence their understanding of medical professionalism and patient care long after the war ended. Camp Butner in North Carolina represented perhaps the most developed example of integrated medical facilities. Situated on roughly 40,000 acres spanning 3 counties, this massive installation served as a combat infantry training facility for approximately 30,000 American soldiers, while simultaneously housing German and Italian prisoners who worked in various capacities throughout the base. The camp's convalescent hospital created an environment where German medical staff worked alongside American colleagues in treating both Allied and Axis patients. The scale and sophistication of this medical operation, the quality of equipment, the systematic approach to patient care, the emphasis on documentation and follow-up, provided German physicians with an immersion experience in American military medicine at its most advanced. Access to educational resources would have been remarkable even for free citizens, let alone enemy prisoners. Nearly every camp established libraries stocked with donated books and magazines, some growing large enough to rival small-town public libraries. Camp Fannin maintained over 2,500 volumes with a circulation rate exceeding 80%, indicating that prisoners actively utilized these resources. For medical personnel, this meant access to current medical literature, professional journals, and textbooks that had been restricted or completely unavailable in Germany due to both wartime conditions and ideological censorship. The regime in Berlin had purged medical libraries of research conducted by Jewish scientists and physicians, creating significant gaps in German medical knowledge. In American prison camps, these restrictions disappeared, and German doctors could read the latest developments in fields ranging from bacteriology to surgery without political filters. Some camps developed extraordinary connections with American universities that further enhanced educational opportunities. A report from Camp Butner in April 1945 noted that 110 prisoners were employed as mess attendants at Duke University and the University of North Carolina. While these particular prisoners worked in food service rather than medical capacities, the university connection created opportunities for German medical personnel in the camp to access academic medical institutions, attend lectures when permitted, and interact with American medical faculty. These university relationships, limited though they were by security requirements and the fundamental nature of the captor-prisoner dynamic, nonetheless represented a level of integration between enemy prisoners and American educational institutions that would have been absolutely unthinkable in Germany under the current regime. As millions of American men shipped overseas to fight, the resulting domestic labor shortage eventually led to German prisoners working in various civilian capacities deemed to pose minimal security risks. They found employment in canneries processing food, lumber mills cutting timber, and farms harvesting crops, essentially contributing to the Allied war effort by keeping American agriculture and light industry functioning. For medical personnel, work assignments typically involved hospitals and medical facilities where their professional skills could be properly utilized. German medical officers who volunteered for such medical work received compensation according to their rank and professional position, as Geneva Convention provisions required. The payment amounts were modest, but the principle mattered enormously to men who expected to be treated as defeated enemies worthy only of contempt. Being paid for professional services constituted recognition of their status as doctors, a validation of professional identity that transcended their status as prisoners. American nurses initially wondered whether they could maintain professional objectivity when caring for enemy wounded. Some struggled with conflicting emotions, knowing that the German soldiers in their care might have killed American soldiers or been complicit in atrocities. Official hospital policy explicitly prioritized Allied casualties over enemy prisoners when resources were limited. Despite these policies and personal reservations, most nurses discovered they could compartmentalize their feelings and view German patients simply as injured human beings requiring medical care. They provided the same attentive nursing, the same careful monitoring, the same compassionate bedside manner regardless of their patient's nationality. This professional discipline, separating personal feelings from professional duties, provided German medical officers with a practical demonstration of medical ethics that transcended political ideology and national identity. The abundance of medical supplies in American facilities contradicted everything German medical personnel had experienced regarding wartime scarcity. Basic necessities that had to be carefully rationed in German military medicine, bandages, antiseptics, surgical instruments, sutures, were available in quantities that seemed almost excessive. Pharmaceutical availability particularly impressed German doctors. Sulfur drugs, which German military physicians doled out sparingly due to limited supplies, were used liberally in American facilities without apparent concern for conservation. The introduction of penicillin to some American military hospitals by 1944 represented a therapeutic capability that German medicine completely lacked, a genuine wonder drug that could cure infections previously considered fatal. German physicians had heard rumors of this miraculous antibiotic, but seeing it used routinely to treat everything from wound infections to pneumonia provided stark evidence of the technological and industrial gap between German and American medical capabilities. Texas, with its numerous prison camps, created a concentration of German prisoners, including significant numbers of medical personnel. The sheer scale of these Texas facilities and their medical components exposed German doctors to American military medicine operating at considerable magnitude. Fort Sam Houston, known as the home of Army medicine and the Combat Medic Training Center, hosted up to 1,000 German prisoners starting in September 1942, while permanent camps were constructed elsewhere. As a major medical training facility, Fort Sam Houston gave German medical personnel opportunities to observe American military medical education and training methods. While their participation in training activities was necessarily limited by security concerns, simply observing how American combat medics were trained provided insights into different approaches to military medical education, emphasizing practical skills and immediate life-saving interventions rather than the theoretical knowledge that dominated German medical training. Dental care, often overlooked when discussing prisoner treatment, provided another dimension of professional interaction between American and German medical personnel. German dentists among the prisoners worked in camp dental facilities, maintaining oral health for thousands of their fellow captives. These dental officers experienced the same professional recognition their medical colleagues received, addressed by professional titles and treated as peers by American dental officers. The American investment in prisoner dental health went beyond emergency extractions to include routine preventive care, fillings, and even some cosmetic work. This commitment to comprehensive dental care demonstrated an approach to prisoner welfare that exceeded minimum Geneva Convention requirements and reflected broader American attitudes about medical care as a right rather than a privilege. German medical officers participated in public health initiatives within the camps, implementing disease prevention measures, supervising sanitation systems, and conducting health education programs for prisoner populations. These activities exposed them to American public health philosophy, emphasizing prevention over treatment, a different approach from German military medicine's overwhelming focus on battlefield trauma. The success of these public health measures in maintaining camp health despite crowded conditions with thousands of men living in close quarters provided practical demonstrations of preventive medicine's effectiveness. German physicians observed how relatively simple measures like proper waste disposal, clean water supplies, vector control, and health education could prevent disease outbreaks that would otherwise sicken hundreds. American approaches to mental health treatment made a particularly strong impression on German medical personnel. Combat fatigue, what later generations would call post-traumatic stress disorder, was recognized and treated as a legitimate medical condition rather than evidence of cowardice or weak character. This represented a fundamentally different philosophy from German military psychiatry, which viewed psychological casualties with suspicion and often treated affected soldiers punitively. German psychiatrists and psychologists among the prisoners observed treatment methods that included psychotherapy sessions, occupational therapy programs designed to restore function and confidence, and pharmaceutical interventions when appropriate. This comprehensive approach to mental health, treating psychological wounds with the same seriousness as physical injuries, contrasted sharply with German military psychiatry's tendency to dismiss psychological suffering as malingering or moral failure. As the war ground toward its conclusion, German medical personnel faced repatriation to a homeland that had been bombed into rubble. Many had spent 2 or more years in American custody, during which they had practiced medicine under conditions often superior to what they had known as free physicians in Germany. The repatriation process included medical examinations and health certifications conducted jointly by American and German medical personnel, a final professional collaboration that reinforced the collegial relationships developed during captivity. This concluding interaction carried symbolic weight, former captor and captive working together as professional equals one last time before the Germans returned to face an uncertain future in a devastated country. After returning home, approximately 5,000 Germans eventually emigrated to the United States, and thousands more returned for visits in subsequent years. Many American farmers who had employed German prisoner labor on their farms recalled these men with genuine admiration and even affection, maintaining friendships that survived the war's end. Among these enduring relationships were professional connections between medical personnel who had worked together in camp hospitals. German medical officers returning to Germany brought with them extensive knowledge of American medical practices, organizational methods, and ethical standards. While the precise impact is difficult to quantify without access to comprehensive personal papers and institutional records, their influence on post-war German medicine was significant, particularly in areas such as medical ethics, patient rights, and professional standards that had been compromised under the previous regime. The exposure to American medical education methods influenced how some returning German physicians thought about medical training. The emphasis on practical clinical experience integrated with theoretical knowledge, the systematic approach to resident training with graduated responsibility, and the importance placed on teaching and learning as ongoing professional obligations were elements that some German medical officers advocated for when German medical schools were rebuilt and reorganized. Several German physicians who experienced American captivity became prominent medical educators in post-war Germany, though establishing direct connections between their teaching philosophies and their prisoner-of-war experiences requires access to personal papers and institutional archives that may not be fully available to researchers. The historical record documenting German prisoner medical personnel in America comes from multiple sources that collectively paint a detailed picture despite inevitable gaps. Official military records preserved in the National Archives provide statistical data, policy documents, and administrative correspondence. International Red Cross inspection reports offer independent verification of conditions and treatment. Post-war memoirs and oral histories give personal perspectives from both German and American participants. Contemporary newspaper accounts provide snapshots of public awareness and attitudes. Camp newspapers published by prisoners themselves offer unique insights into prisoner perspectives and daily life. These varied sources, while valuable, leave many questions unanswered about the full extent of professional relationships and knowledge transfer that occurred in these unique circumstances. German pharmacists and pharmacologists among the prisoners gained exposure to American pharmaceutical practices that differed substantially from their experience. They observed mass production techniques achieving consistent quality at scales German pharmaceutical companies had never matched. Quality control standards, systematic testing and verification procedures ensured medication safety and efficacy. Distribution systems efficiently moving medications from manufacturers to end users demonstrated logistical capabilities that impressed prisoners accustomed to German supply chain chaos. The sheer availability of medications in American camps, from basic aspirin to advanced antibiotics, showcased production capabilities that exceeded anything German pharmaceutical industry had achieved even during peacetime. This exposure to American pharmaceutical abundance and systematic approach influenced how German medical personnel understood what modern medicine could accomplish when adequately resourced. The exchange of surgical knowledge between American and German medical personnel represented one of the most practical aspects of their professional interaction. German surgeons brought extensive battlefield experience, having developed trauma treatment techniques through years of combat medicine under desperate conditions. They shared knowledge about managing massive injuries, performing surgery with limited resources, and making difficult triage decisions when patient numbers overwhelmed available medical personnel. American surgeons reciprocated by sharing advances in anesthesia allowing safer surgery, aseptic techniques reducing infection rates, and post-operative care protocols improving outcomes. This bidirectional knowledge transfer, while inevitably limited by language barriers and security constraints that prevented completely open exchange, nonetheless enriched both medical communities and ultimately benefited patients on both sides. German medical technologists and laboratory specialists working in camp laboratories conducted routine diagnostic tests supporting medical operations. These personnel gained familiarity with American laboratory methods, equipment superior to what they had used in German military facilities, and quality control standards ensuring accurate results. The systematic approach to laboratory medicine in American facilities, standardized procedures applied consistently, regular equipment maintenance preventing breakdowns, comprehensive record-keeping tracking results and trends, provided models that influenced post-war German laboratory medicine development. Simple things like equipment manuals written in clear language, scheduled calibration preventing drift, and systematic troubleshooting procedures represented professional practices that some German laboratory personnel had never encountered. German radiologists and X-ray technicians operating equipment in camp medical facilities appreciated American radiology equipment for its reliability and image quality. They had grown accustomed to maintaining deteriorating equipment with scarce replacement parts, coaxing usable images from aging machines that should have been replaced years earlier. American equipment was newer, better maintained, and produced clearer images that aided diagnosis. Safety protocols in American radiology practice, including radiation protection measures for both patients and operators, exceeded German standards and reflected greater awareness of radiation hazards. These safety practices, simple precautions like lead aprons and dosimeter badges, demonstrated that American medicine valued long-term health consequences, not just immediate results. The International Red Cross played crucial mediating roles in German prisoner medical personnel experiences. Red Cross inspectors verified that medical personnel received treatment according to Geneva Convention provisions, including professional recognition and appropriate work assignments. Their inspection reports documented conditions, noted deficiencies requiring correction, and provided independent verification that prisoners received humane treatment. Red Cross packages supplemented medical supplies in some camps, though American military medical supply was generally adequate without supplementation. More importantly, the Red Cross facilitated communication between German medical personnel and international medical communities, maintaining connections to broader medical developments despite imprisonment. This connection to the wider medical world helped German physicians maintain professional identity and prevented complete isolation from their profession. Many prison camps published newspapers written by and for prisoners. These publications, subject to American censorship to prevent security breaches or propaganda, but generally allowed considerable freedom otherwise, included medical and health content written by German medical personnel. Articles covered topics like health education teaching prisoners about disease prevention, nutritional guidance helping prisoners maintain health despite institutional food, and medical news keeping readers informed about developments in medicine. These publications provided German medical personnel with platforms to maintain professional identity, share knowledge with fellow prisoners, and continue educational activities despite imprisonment. The newspapers, preserved in various archives and libraries, offer unique insights into German medical personnel perspectives on their experiences, revealing how they understood and processed what they were witnessing. Some German medical personnel received permission to conduct limited medical research during American captivity. This research focused on non-sensitive topics such as nutritional deficiencies among prisoner populations or disease patterns in camps that might yield useful public health insights. Prisoners could not research anything potentially useful for military applications, but purely medical topics were sometimes permitted. The ability to conduct even limited research with access to laboratory facilities and statistical support exceeded what many German medical researchers had available in wartime Germany's deteriorating research infrastructure. Maintaining research skills, formulating hypotheses, collecting data, analyzing results, and drawing conclusions kept scientific thinking sharp and preserved capabilities that would prove valuable when these men returned to Germany and participated in rebuilding medical research institutions. Disease outbreaks in prison camps required coordinated medical responses, bringing American and German medical personnel together in urgent collaboration. When influenza swept through a camp or gastrointestinal infections struck hundreds simultaneously, national enmities became irrelevant in the face of immediate medical crisis. These epidemic responses demonstrated American epidemic control methods and public health responses, systematic approaches to investigating outbreaks, implementing containment measures, and deploying mass treatment protocols. German medical personnel participated actively in these responses, gaining practical experience that would prove valuable in post-war Germany, where public health conditions were often desperate with widespread malnutrition, contaminated water supplies, and overcrowded housing creating perfect conditions for epidemic disease. German medical officers observed American medical supply management systems that ensured consistent availability of necessary materials despite enormous demand from a global war effort. The systematic approach to inventory management, tracking supplies from procurement through consumption, emergency stockpiles providing buffers against supply disruptions, and distribution networks efficiently moving materials where needed, provided models for effective medical logistics. This exposure to American medical supply chain management influenced how German medical officers understood modern medical system requirements. The knowledge proved particularly relevant for rebuilding Germany's destroyed medical infrastructure, where establishing reliable supply chains represented a fundamental challenge. Treatment of combat wounds in camp hospitals exposed German medical personnel to American advances in wound care that had been developed through hard battlefield experience. Liberal use of antibiotics to prevent infection transformed wound management, allowing survival of injuries that previously would have proven fatal due to sepsis. Advanced surgical debridement techniques, carefully removing damaged tissue while preserving viable structures, improved healing and reduced complications. Systematic approaches to wound documentation, photographing injuries and tracking healing progress enabled quality improvement and knowledge sharing. German medical personnel observation of and participation in American wound care protocols influenced post-war German trauma medicine, contributing to improved outcomes for civilian trauma victims in reconstructed Germany, where industrial accidents and vehicle crashes created steady streams of injured patients. American emphasis on preventive medicine in prison camps exposed German medical personnel to a different medical philosophy than they had practiced. Routine health screenings identified problems before they became serious, vaccination programs prevented communicable diseases, and health education initiatives taught prisoners how to maintain their own health. This preventive approach, while not unknown in German medicine, had received lower priority in German military medicine, overwhelmingly focused on battlefield trauma and acute injuries. Exposure to comprehensive preventive medicine programs, seeing how relatively modest investments in prevention could avoid much larger treatment costs later, influenced German medical personnel thinking about medical practice priorities and resource allocation. American rehabilitation medicine for wounded soldiers particularly impressed German medical personnel. The emphasis on returning wounded soldiers to maximum possible function, rather than simply pensioning them as permanent invalids, represented a fundamentally different approach to disability. German medical personnel observed physical therapy programs using exercise and manual therapy to restore movement and strength, occupational therapy teaching practical skills for daily living despite impairments, and vocational rehabilitation programs preparing wounded soldiers for civilian employment. This comprehensive approach to rehabilitation exceeded anything available in German military medicine and reflected American optimism about human potential even after severe injury. Exposure to these rehabilitation philosophies influenced post-war German rehabilitation medicine development, though implementation was constrained by limited resources in devastated post-war Germany. American medical communication methods differed from German practices in ways that seemed subtle but proved significant. The emphasis on clear documentation, creating medical records that other providers could easily understand, patient education, explaining conditions and treatments in accessible language, and interdisciplinary communication, ensuring all team members understood care plans, provided models for effective medical communication. German medical personnel exposed to these communication methods carried them into post-war practice, contributing to more patient-centered and collaborative medical care in rebuilt German medicine. Simple practices like taking time to explain diagnoses and treatment plans to patients, involving patients in medical decisions affecting their care, and ensuring clear handoffs between shifts represented cultural shifts in medical practice that some returning German physicians promoted. The experience of German prisoner medical personnel in American captivity demonstrates that professional identity can transcend national enmity even during total war. The American Medical Corps treatment of captured German physicians as respected colleagues, engaging in mutual teaching and learning of medical procedures, established relationships that outlasted the conflict and influenced post-war medical practice. While the full extent of knowledge transfer and professional relationships remains incompletely documented without access to all relevant archives and personal papers, available evidence clearly shows that German medical personnel experienced professional recognition exceeding their expectations and often surpassing their previous experience in German military medicine. This professional treatment was not universal or without complications. Security constraints necessarily limited how fully German medical personnel could integrate into American medical operations. Language barriers frustrated communication despite earnest efforts on both sides. The fundamental prisoner-captor relationship created inherent power imbalances that shaped all interactions. Some American medical personnel maintained professional distance, unwilling to fully embrace former enemies as colleagues. Some German medical personnel resisted American approaches, clinging to German medical traditions and rejecting innovations as unnecessary complications. These limitations and tensions were real and consequential, preventing the kind of complete professional integration that might have occurred between allied medical personnel. Nevertheless, the documented experience of German prisoner medical personnel in America represents a remarkable chapter in military medical history worthy of study and reflection. The decision to treat enemy medical personnel as professional colleagues rather than merely defeated enemies reflected both American adherence to international law obligations and fundamental values within American military medicine. The impact extended beyond individual German medical officers to influence post-war German medicine more broadly. While establishing direct causation remains difficult without comprehensive longitudinal studies, German medical officers who experienced American medicine during captivity contributed to post-war German medical reconstruction, bringing knowledge of American methods, ethics, and organizational approaches. The story of German prisoner medical personnel in America ultimately demonstrates medicine's capacity to maintain professional bonds even during the most destructive war in human history. In treating enemy medical personnel with professional respect rather than mere adherence to minimum legal requirements, American military medicine demonstrated values transcending immediate conflict. This historical example remains relevant for contemporary military medicine and international medical relations in our own time. The principle that medical professionals share obligations transcending national boundaries, demonstrated practically in American treatment of German prisoner medical personnel, continues to guide military medical ethics and international medical cooperation in current conflicts and crises. The German medical officers who experienced American collegiality, rather than the enmity they expected, returned to Germany carrying more than technical medical knowledge about new procedures and medications. They carried the profound experience that professional respect could survive even total war between ideologically opposed nations, that medical ethics could transcend political ideology even when that ideology claimed to represent fundamental truths about human nature and society, and that former bitter enemies could become colleagues in medicine's universal mission of healing humanity's wounds. This lesson about the resilience of professional values and human decency, even amid catastrophic conflict, represents perhaps the most enduring legacy of their unique experience in American captivity.